Medicines used in the elderly. Prescribing for the older patients presents unique challenges, and many medications need to be used with special caution because of age related changes in the absorption, distribution, metabolism, and excretion of the drug, as well as physiologic effects of the drug. In particular, physiologic changes in the body composition, renal and hepatic functions play vital roles in determining changes in drug levels and the risk of adverse drug events in the elderly. There is also the issue of multi-morbidity in the elderly, which leads to the prescribing of multiple medications. The more medications prescribed for the elderly person, the higher the risk of adverse effects and other drug interactions. Let's look at the base criteria. This is the American Geriatric Society 2012 base criteria update experts panel, and this gives a list of medications considered inappropriate for older patients, either because of ineffectiveness or high risk of adverse events. The causes of adverse drug events: polypharmacy, use of inappropriate medications, underutilization of appropriate medication, and transitions in care settings. The management. The main treatment objective is to prevent adverse drug events, as AD, and preventive measures, education on drug use for the elderly and their families or caregivers, proper drug history taken by a healthcare provider, and also quality measures of drug prescribing, avoidance of inappropriate medications, appropriate use of indicated medications, monitoring for side effects and drug levels, also avoidance of drug and drug food interactions, involvement of the patient or family, and integration of patient values, maintenance of an accurate list of all medications that the patient is currently using. So periodic polythene bag checkups, that is instruct patients to bring all pill bottles and containers on each medical visit, including empty packets and containers, and these should be checked against the medication list. Patients should be made aware of potential drug confusions, that is sounds like names, and also look-alike pills and combination medications. Inform patients of both geriatric and brand names, including spelling, as well as the reasons for taking their medications. Medicine organizers prepared by the pharmacist can also be helpful in ensuring that patients take their medications correctly. So, simple medical question checklist: is there a clear indication for this medication? Is it working? Are there side effects? Is the patient taking the medication routinely? Does the medication need lab monitoring? Is it still needed? Is the principles of rational drug prescribing for elderly patients? Rational drug prescribing for elderly patients. Periodically update and review the medication list. Work with the community pharmacist. Educate the patients about the medication. Consider adverse drug events as a cause of any new patient symptom. Simplify the medication regimen and start one medication at a time at lowest possible dose.